When scientists want to understand something about the world, whether it is how a new medicine works, how people make decisions, or how ecosystems change, they almost always study a sample rather than the entire population. But here is a crucial question. Does what we learn from that sample actually apply to the larger world? This is the heart of what researchers call external validity, the ability to generalize findings beyond the specific study. And one of the most important factors that determines external validity is the sampling strategy. Let's break this down with a simple example. Suppose you are testing a new educational app meant to help students learn math more effectively. You gather 50 students from a single private school in a big city and run your experiment. The results are excellent. Students using the app improve their scores significantly. Great news, right? But here's the question. Will the app work just as well for students in rural schools? Or for those with limited internet access? Or for students who speak a different first language? If your sample only includes a narrow group, your findings may not hold true in the real world. That's a problem of external validity. So how does sampling strategy influence this? Sampling is not just about choosing a few participants at random. It involves important decisions: who is included, who is excluded, and how they are selected. If a study only samples from a specific subgroup, like young, healthy volunteers in a medical trial, the results may not apply to older adults or people with underlying health conditions. This is a common issue in medical research, where early studies may work beautifully in the lab or among volunteers, but show limited effectiveness when rolled out to a broader population. One way to improve external validity is to use stratified or representative sampling, where researchers deliberately include people from different backgrounds, regions, ages, or health statuses. For example, if a vaccine trial includes participants from various ethnic groups, climates, and health profiles, we can be more confident that the findings apply to diverse populations. But this kind of sampling takes more time, money, and planning, so it is not always done, especially in early studies. Sometimes researchers use convenient samples, meaning they choose participants who are easiest to reach, like university students or online users. This can speed up research, but it comes with a trade-off. The findings may only reflect the behavior of that narrow group. Ask yourself this: if we only test a product on tech-savvy college students, will it work for older adults who are not comfortable with technology? Probably not. That is the hidden cost of limited sampling strategies. You might wonder, does this mean that small or focused studies are useless? Not at all. Every study teaches us something, but it is important to recognize the limits of what a study can tell us. A small sample can suggest an exciting idea, but before changing public policy or launching a global product, we need evidence that it works in the broader world. That's why replication studies, testing the same experiment in different places or with different groups, are so important in science. They help confirm whether findings are truly generalizable. Interestingly, technology is opening up new ways to assess external validity. With large-scale data, online platforms, and even AI-driven participant selection, researchers can now include more diverse and globally distributed samples. Still, the principles remain the same. If we want our results to matter outside the lab, we must think carefully about how we select the people we study. In the end, sampling is more than a technical detail. It is a bridge between the study and the world. A strong bridge can carry ideas far and wide. A weak one may collapse when stretched. By paying close attention to how we sample, we ensure that the knowledge we create in research can truly improve lives, inform decisions, and help us understand the broader reality, not just a sliver of it we happen to observe. External validity refers to the degree to which study findings generalize beyond the specific sample and setting to a broader target population, depending critically on how well the sample reflects the characteristics, context, and variability of that target population. Poor external validity limits the applicability of conclusions to real-world settings, undermining evidence-based decision-making, and assessing external validity requires careful consideration of sampling bias, sampling frame coverage, and representativeness metrics. A clinical trial recruiting only urban, college-educated participants may yield efficacy results that fail to generalize to rural or lower-income patients. It's like testing a new car model only on smooth highways and expecting the performance data to apply equally on rough, unpaved roads. Sampling strategies are systematic approaches to selecting units, individuals, sites, observations from a larger population for inclusion in a study, falling into two broad categories: probability sampling, random stratified cluster, which enables quantifiable inference about population parameters, and non-probability sampling, convenience, purposive, snowball, which often sacrifices generalizability for feasibility. Each strategy carries unique strengths and biases that directly affect external validity, making understanding these trade-offs essential for designing studies whose results can be reliably extrapolated. A stratified sampling design deliberately oversamples minority subgroups to ensure their adequate representation in national health surveys. It's like baking a cake recipe, but adjusting ingredient proportions to ensure each slice has the same flavor, rather than randomly scooping batter. Probability sampling ensures every unit in the target population has a known non-zero chance of selection, minimizing selection bias and enabling calculation of sampling error, whereas non-probability sampling selects units based on convenience or researcher judgment, often resulting in unknown selection probabilities and limited generalizability. While probability methods maximize external validity, they require comprehensive sampling frames and greater resources, and non-probability approaches can be pragmatic for exploratory research, but necessitate caution when extending findings. A nationwide voter poll using simple random sampling yields margin of correct estimates, whereas a convenience online survey cannot quantify its sampling error. Probability sampling is like drawing lottery tickets from a well-shuffled drum, whereas non-probability sampling is like picking tickets from a stack that only includes your friend's name. Simple random sampling is the gold standard for external validity because it produces samples that are statistically representative of the target population when executed correctly, eliminating systematic selection biases and supporting unbiased estimation of population parameters with calculable confidence intervals. However, it relies on a complete sampling frame and may be inefficient for rare subgroups, and its logistical complexity and costs can limit feasibility in large or hard-to-reach populations. A national health survey, randomly selecting phone numbers from all active area codes, produces generalizable prevalence estimates for chronic diseases. It's like randomly drawing marbles from a well-mixed jar, so that every marble has an equal chance of being chosen. Stratified sampling divides the population into homogeneous subgroup strata and randomly samples within each stratum to ensure proportional representation, enhancing external validity by reducing sampling variance and guaranteeing adequate inclusion of key subpopulations. Stratification is especially valuable when certain strata differ markedly on outcome variables, and proper weighting of strata during analysis preserves unbiased population estimate. In educational research, stratifying schools by urban/rural status ensures both types are proportionately represented in student achievement studies. It's like slicing a layered cake so each piece contains all flavors in the same proportions as the whole cake. Cluster sampling selects naturally occurring groups, clusters, randomly and then samples all or a subset of units within chosen clusters, simplifying logistics and lowering costs for geographically dispersed populations, but introducing intra-cluster correlation that reduces effective sample size. Accounting for cluster design effects in analysis is essential to maintain external validity, and when clusters are heterogeneous, cluster sampling approximates random sampling, while homogeneous clusters risk biased estimates. A national household survey randomly selects census tracts, clusters, and interviews every household within selected tracts. It's like surveying apples by randomly picking entire trees rather than individual apples scattered across an orchard. Convenient sampling recruits participants based on ease of access, while purposive sampling targets units with specific characteristics. Both methods expedite data collection and reduce costs, but severely limit external validity because selection probabilities are unknown, making findings hypothesis generating rather than confirmatory, and requiring replication using probability methods for generalization, with transparency about sampling limitations critical in reporting. A usability study recruits volunteers from a university campus for convenience, yielding insights that may not generalize to older or non-student populations. It's like tasting a dish, only with salt preferences similar to your own and assuming everyone will enjoy it equally. Quota sampling enforces pre-specified quotas for subgroups without random selection within quotas, partially mimicking stratification but lacking randomization, whereas snowball sampling relies on participant referrals to recruit hard-to-reach populations, introducing network biases. Both facilitate inclusion of niche or marginalized groups, but produce unknown selection biases, so analyses from these samples should be interpreted with caution regarding population generalizability. A study of undocumented immigrants uses snowball referrals through community organizations to recruit participants otherwise inaccessible via official registries. It's like assembling a team by asking each current member to bring along friends. Creating clusters of similar characteristics. To optimize external validity, researchers should use probability sampling whenever feasible, employ stratification for known population heterogeneity, and calculate design effects for cluster samples. When non-probability sampling is unavoidable, they should combine it with weighting adjustments, sensitivity analyses, and transparent reporting of limitations, and pre-registration of sampling protocols and sharing sampling frames improve reproducibility and trust. Ultimately, aligning sampling strategy with research objectives and population characteristics is key to valid, generalizable inference. A clinical trial pre-registers its stratified random sampling plan and reports recruitment metrics to demonstrate representativeness of enrolled participants. It's like building a custom key by carefully matching every tooth shape to the lock rather than hoping a generic key will fit.